What went wrong in the Gambia, which led to so many African children dying from taking cough syrup that was contaminated with toxic chemicals? And could it happen again?
First and foremost, on the watch of the NRA in the countries,
Mhm.
they, and I'm part of the NRA as well,
Yeah.
we failed. And we have to take this very, very personally and say, this has happened on our watch. So,
Yes.
what is your role if you, the person to protect the patient,
Mm.
you failed? Why did this occur? Will it happen again? It has proven that this issue can happen again. This has happened in 2022, not long ago.
Mm.
I can't say I was a young boy then, but it was happening in 2022. It was happening in 2023. This has been a scourge for the last 80 years. If you look at the statistics, it's kind of the low income or the low to middle income countries, and a
Mm.
lot of the deaths and injuries has occurred here. So what actually happened here? This was a medicine
Yes.
manufactured for children, and it is packaged very functionally. So it really there's child on the box. It's got the ingredients. Everything is there.
Yeah.
But glycerine is utilized a lot in the manufacture of cough syrups. And glycerine is there to increase the solubility of the other ingredients. Okay.
Yes.
So if you look at an ingredient that may be insoluble in water, which is also sometimes a base of cough syrup, but the active ingredient or the inactive ingredients, excipients,
Mm.
these do not dissolve in the water. So you have a solvent aid to then promote the dissolution
Yes.
of these excipients and APIs in the base of the cough syrup.
Mm.
And one of that excipients is glycerine. So glycerine is what we would call an inactive, right?
Mhm.
It's there as a sweetener as well. So because some of the cough syrups taste bitter, and unfortunately, glycerine is one of those group of excipients which do not differ much from something called diethylene glycol.
Mm.
And diethylene glycol is a material or is a excipient as well that shouldn't be in medicine. This diethylene glycol is actually used when you put what we call antifreeze in a car to prevent the water from boiling, essentially, and overheating your car. You put in this product called diethylene glycol. And it has many uses, as uses even in as a paint stripper. None of these uses are medical related at all. So how does it come into the medicine? So what we have found, and various investigations have found, is that the diethylene glycol is a much cheaper alternative
Mm.
than glycerine. Okay. So instead of you having 100 liters of glycerine, they put 50 liters of glycerine and 50 liters of diethylene glycol. And because it is an excipient,
Mm.
our vigilance with regard to excipients has been a bit lacking. We focused a lot on the APIs. Does it have chlorpheniramine? Does it have diphenhydramine? So we have not been able to put effective measures in place to pick up these contaminants in excipients.
Are there other products on the same market or even on the larger African market which are substandard falsified and it's documented that it's a lot of products?